but you're probably not. All right, healthcare delivery systems. The healthcare industry is made up of many delivery systems. A delivery system is a facility or organization that provides healthcare services. There are many types of delivery systems. Hospitals, long-term care facilities, medical offices, and laboratories are all examples of delivery systems. Delivery systems can be owned by private companies, belong to a government agency, or function as a nonprofit organization. And that might be like the first question on the worksheet, is that right? Huh.
I have a question.
Yes.
Do you know how to put the page back to full, like that?
No, I don't. Sorry, okay. So while we're doing this, do you guys like to fill in your quizzes? I mean, your worksheets? Yes?
Yeah.
Feel free to do so, okay? All right, components of healthcare, components of delivery systems. Although each system is different, all healthcare delivery systems share these basic components. Services. All delivery systems provide one or more healthcare services to a specific group of people. Consumers. Any person who needs healthcare services. Healthcare personnel. Staff that administers healthcare delivery system services. And payment for services, which is methods of payment for delivery system services. What? Keep up. We're gonna go over it, don't worry. Hospitals. A hospital is a healthcare facility that provides healthcare services. Hospitals vary in size, ownership, and the types of service they provide. Some hospitals are small and provide basic needs for a community. Other hospitals are large and offer a wide range of services that include treatment, education, and research. Ownership. Many hospitals are classified as proprietary, which means they earn a profit from their services. Proprietary hospitals are usually privately owned agencies. Hospitals that provide their services for no profit are called nonprofit or voluntary. Other forms of hospital ownership include government hospitals and religious hospitals. Services. General hospitals treat a variety of conditions. Specialty hospitals provide services for particular conditions or age groups. For example, pediatric hospitals treat children, and oncology hospitals treat individuals with cancer.
Just religious hospitals?
Yeah, like Mother Teresa's whatever, or, you know, like anything with, I'm trying to think of something big that you would know of. Like St. Benedict's, or,
I did not know that. I did not.
you know, back in the day, they would have like nuns that would be nurses there. All right, long-term care facilities. Give me 10.
Should I close that?
10 push-ups, because he's snapping his thing and it's loud on my recording.
10.
10 push-ups, 10 jumping jacks.
Alright.
A 10-minute plank.
Oh, that, no.
10 minutes.
All right.
That
Long-term
was
care
hard.
facilities are another type of healthcare delivery system. They mostly provide care for elderly patients. However, some long-term care facilities offer treatment for patients with disabilities or those in rehabilitation. Number 4. Different long-term care facilities provide different levels of care. For example, nursing homes care for patients who can no longer care for themselves, whereas independent living facilities allow patients to rent an apartment and use only the services they need. These services may include transportation, housekeeping, and laundry. Medical offices. Medical office is a type of delivery system. Examples include the family doctor, the eye doctor, and the dentist. Some medical offices are operated by just 1 or 2 doctors, and others are made up of large groups of physicians and healthcare professionals. Like hospitals, some medical offices treat a wide range of conditions. A family doctor, for example, will examine a variety of patients. However, many medical offices are specialized and offer treatment for specific conditions or age groups. Ophthalmologists examine only eyes, and cardiologists deal only with diseases of the heart. Behavioral health services make up a significant part of the healthcare system. Behavioral health involves a connection between behavior, health, and well-being. Some behavioral health issues are the result of individual choices. Others, however, can be outside the patient's control. Medical studies show that a healthy mind is just as important as a healthy body. Some behavioral health facilities treat patients suffering from behavioral or mental health disorders. Others provide counseling to people struggling with substance abuse and addiction. Another important role of behavioral health facilities is to provide aid to victims of abuse and domestic violence. Part of that aid might involve directing patients to an organization or resource such as these for additional help. Behavioral health services commonly encounter patients needing treatment in the following areas. Anxiety. The American Psychological Association describes anxiety in regard to both emotional and physical symptoms that include tension, worry, recurring intrusive concerns, as well as higher blood pressure, sweating, dizziness, and an accelerated heartbeat. Depression refers to depression as a serious medical illness affecting both feelings and actions. Left untreated, it can affect a person's ability to function in both their professional and personal lives. Symptoms of depression are widespread but commonly have a negative impact on mood, interest, appetite, and sleep. Substance abuse. Use of alcohol, drugs, or other substances that affect health, work, school, or home life is considered substance abuse. Suicide, or purposely ending one's life, is a risk associated with failing to treat the behavioral health issues mentioned above, along with many others. Behavioral health services and facilities do their best to assist patients with issues that might eventually put them at risk of suicide. Other systems. The healthcare industry includes many other delivery systems. Here are a few. Emergency care services provide immediate aid for sick or injured. Acute care facilities treat patients with sudden illness, trauma, injuries, and post-injury and post-surgery recovery issues. A stay in the acute care facility is typically very short, with patients soon being released to go home or to another type of facility. Ambulatory or outpatient care centers provide a broad range of services, many of which are also available at a hospital. These services include diagnosis, treatment, consultation, and intervention. The biggest difference between hospitals, inpatient, and ambulatory care services, ambulatory care centers, are the length of stay and the general health of the patient. Ambulatory care centers serve patients with procedures that require a stay less than 24 hours and patients that are generally healthy. Dental clinics are similar to dental offices, provide dental procedures and treatments. However, dental clinics offer services at low or no cost. Clinics can be found inside or connected to other healthcare facilities, schools, or government offices. Hospice facilities provide palliative care and counseling for terminally ill patients. Laboratories perform tests to help diagnose illness and disease. Home health agencies offer patients treatment and therapy at home. The healthcare industry is growing rapidly. There are endless opportunities for careers, advancement, and personal growth. Holy moly, this is a long one. All right, we're almost done. Specialty medical and dental services. In addition to general medical and dental services, there are many specialty services. Here are a few. Cosmetic surgery, also called plastic surgery, covers a wide range of services. It involves procedures and surgery intended to improve the patient's appearance. Pulmonology involves the respiratory system and the lungs. Pulmonologists are specialists that treat patients experiencing any kind of respiratory-related issues ranging from asthma to tuberculosis. Chiropractic is non-invasive therapy involving the treatment, usually called an adjustment, of a patient's spine and joints in relation to the nervous system. Orthodontics is a dental specialty involving correction and prevention of irregularities in the teeth and jaw. Surgical, specialties for different body systems, age groups, and specific conditions. Examples include neurological surgery, ophthalmic surgery, and pediatric surgery. Palliative care provides care for people with life-limiting illnesses. Care may include collaboration with the patient's other medical providers, emotional, spiritual, and social support, and advanced care planning. The goal of palliative care is to provide or improve quality of life for patients and their family members and minimize symptoms and stress related to the illness. Palliative care should not be confused with hospice care, which is palliative, quality of life care for patients at the end of life stage. worksheet done?
One
No.
question has like three parts.
Oh, gotcha.
Oh,
What are you
we
pointing
were
at?
supposed to do the worksheet?
The phone.
Oh. Yes, you redeemed yourself.